Preimplantation genetic diagnosis testing, known as PGD, is a method for detecting genetic defects in fertilized embryos obtained through an IVF procedure. Preimplantation genetic testing prevents the transfer of genetically compromised embryos to the intended mother, and therefore prenatal diagnosis tests such as an amniocentesis may be avoided. Chromosomal abnormalities are common in embryos and are one of the main reasons women fail to conceive with IVF or spontaneously as they age. It is known that about 60% of embryos in women under 35 years of age and 80% of embryos in women over the age of 41 will have a chromosomal abnormality. The ideal candidates who should seek PGD testing prior to having a child are as follows. If the female partner is 35 years of age or older and at increased risk for having a child with a chromosomal abnormality. If the couple has had recurrent miscarriages of unknown cause. The couple has had a previous child or pregnancy with a chromosome abnormality. The couple is concerned about having a child with a chromosome abnormality. The couple has had a previous unsuccessful IVF cycle despite good quality embryos. If one member of the couple carries a known chromosomal defect, or if the couple is at risk of having a child with an inherited single-gene genetic disease. Testing provides an increased chance of having a healthy child since the embryos that have been tested and found healthy are still viable for use in the implantation process. There are three main things tested with a PGD screening. One is chromosome rearrangements. Two is single gene disorders such as Tay-Sachs or muscular dystrophy. Three would be aneuploidy, where there are either too many or too few chromosomes, such as with Down syndrome or Turner syndrome. The first step in a PGD is a removal of 1 to 2 cells from the embryo. These cells are then evaluated to determine any problematic gene inheritance. Then, embryos that are free of disease and genetic problems are then placed into the uterus for implantation. Any additional embryos that are free of disease and genetic problems can be frozen for later use. There are 4 main benefits to PGD testing. It can test for over 100 varying genetic disorders. It allows the couple a chance to have a healthy child. 3 is that the couple can actually select gender if desired. And 4th, the procedure permits couples to pursue biological children. If you or a loved one is in need of first-rate help achieving your fertility goals, let PRC Dubai help you today. Call us at 800-800-4544 and visit us at prcdubai.com. We create families every day, and our success is measured in birthdays.